Thank you very much, and thank you to all of you for joining this hearing on our nation's preparedness to combat public health threats as we look towards now reauthorizing the Pandemic and All Hazards Preparedness Act later this year. And I especially want to thank Senator Casey and Senator Burr for their bipartisan work and leadership on this really important issue. Local Washington State papers show why today's discussion is so important to families across this country. We have headlines like flu deaths and cases increasing in Pierce County, and flu outbreak in Snohomish County kills 5, 50 hospitalized. A bad flu season can be a nightmare for families and too often ends in horrible tragedy. Just as we must continue to improve our public health response across the board to prevent those tragedies on the local level, we have to also make sure we are vigilant against pandemics of a global scale. A pandemic could affect 500 million people, more than the entire population of the United States. And that's not speculation. It happened 100 years ago. The 1918 influenza epidemic was a tragedy more deadly to the human race than World War I. And today, the threat of pandemic flu is joined by new threats. So what have we learned in the last century? Are we better prepared for the next catastrophe? When you consider Ebola and how the Centers for Disease Control and Prevention and so many partners supported Nigeria as they instituted evidence-based policies and tracked the path of that disease and contained it when the outbreak reached Lagos, the answer is clearly yes. When you consider our strategic national stockpile, which can deliver 50 tons of emergency medical supplies anywhere in the U.S. in 12 hours, the answer is clearly yes. When you consider the FDA's approval of new medical countermeasures to combat anthrax and flu and radiation and plague, the answer is clearly yes. However, our track record is far from perfect. We still can do better. We can do better than the President's way too slow response in Puerto Rico and the U.S. Virgin Islands after Hurricane Maria. The storm left many Americans without access to clean water and electricity and health care for months. We can do better than the administration's response to the opioid epidemic. President Trump declared the crisis a public health emergency 83 days ago and has taken little meaningful action since. So I'm glad this committee will continue its bipartisan work to address the opioid crisis in another hearing soon. We can also do better than our slow response in improving funding to combat Zika in 2016. The World Health Organization declared Zika a global health emergency in February. Instead of a fast response with needed funding, the response got politicized around some Republicans who pushed to undermine women's health care and access to contraception, which was a key requirement to prevent the virus from causing devastating birth defects. As a result, that took Congress 9 months to pass emergency funding for a public health crisis that endangered mothers and babies and families across the world. That delay hurt people and it harmed families in ways they're going to carry for the rest of their lives. So we have to do better. We are most successful at protecting our families against pandemic threats when we respond with quick, bipartisan action. We need decisions based in science and expert medical opinion, not ideology, especially when it comes to women's health. We need federal, state, and local agencies to hire the people and capacity and have the funding they need to protect communities. Hiring freezes and funding cuts make us less prepared, not more. We need to plan for everyone. We can't overlook the young or the elderly. We can't forget pregnant women or individuals with disabilities or those fighting chronic diseases like diabetes. We need innovative medical countermeasures to protect us from today's threats like a universal flu vaccine and antibiotics to combat resistant bacteria. And we must continue strong partnerships with industry that will allow us to rapidly respond to new threats. We need to stop fear and uncertainty before they create panic by getting families helpful and accurate information from sources that they trust. We can't allow anyone to undermine the science of proven solutions like vaccines. We need to respond to global health crises abroad before they travel here to home. Diseases are not stopped by borders or walls or bans. This is a place where the United States can and should lead. We should continue to show our international partners that we are focused on these issues and will be their ally in preparing for and addressing public health threats. Congress has a strong bipartisan track record of addressing these challenges through the PAPA, which strengthened our nation's public health preparedness and created new roles and programs and authorities for public health emergency response. Reauthorizing the Act in 2013, we built on that record and enhanced medical surge capacity. We modernized biosurveillance capabilities and increased our focus on at-risk individuals. I'm hopeful we can continue that progress with legislation that focuses on the science and evidence-based policies we know work to mitigate public health crisis, that considers the needs of everyone and puts families and women before politics, supports state and local public health officials, ensures communities don't spend months waiting for needed emergency resources, and enables us to respond to the next crisis with foresight rather than learn from the next tragedy with hindsight. We don't know what the next public health threat will be. We don't know where or when or even how it'll start. But we do know that being prepared starts now. All of you here today have a critical role to play in keeping our communities healthy and safe. The Food and Drug Administration helps facilitate the development and review of medical countermeasures and grants emergency use authorizations for products that are needed on the front lines. The Assistant Secretary of Preparedness and Response guides our nation's preparedness planning. They help ensure our healthcare system is ready to face any emergency. And it invests in medical countermeasures pipeline through the Biomedical Advanced Research and Development Authority. The Centers for Disease Control and Prevention is on the front lines, supporting state and local public health departments, overseeing the strategic national stockpile, gathering and analyzing key data, and serving as a trusted source of information to the public. I'm interested to hear from all of you today about your work to fulfill these important roles and keep our country safe. Mr. Chairman, I do want to say I am frustrated that Director Fitzgerald is once again unable to join us here today. Due to conflicts of interest presented by investments, our CDC director still has to recuse herself on some of the important health issues that we face, including issues related to data collection and information sharing, which are very relevant to the conversation that we're having today. I'm concerned that she still can't give her full attention to all the pressing health threats we face and hope that these conflicts of interest will be resolved soon. Thank you, Dr. Redd, for joining us in her place, and I look forward to hearing from you and all of our witnesses. Thank you, Mr. Chairman.
Thanks, Senator Murray.